Again, we thank you for joining us for this session of the North Central Farm and Ranch Stress Assistance Center webinar series, presented to you by the National AgrAbility Project. My name is Paul Jones. I manage the National AgrAbility Project, which is headquartered at Purdue University. And our topic today is Farm Stress Voucher Programs, a three-state overview. We have three presenters today: Casey Hulshoff from University of Illinois, Jendal Wolf from the University of Missouri, and Sean Brotherson from North Dakota State University. For those of you who are not familiar with the USDA Farm and Ranch Stress Assistance Network, commonly known as FARSAN, it was first authorized through the 2008 Farm Bill, and it establishes a nationwide network to provide stress assistance programs to people in agriculture. There are 4 regional FARSAN centers. Again, this webinar is coming to you through the North Central Farm and Ranch Stress Assistance Center, but there is a Western Center, a Northeastern Center, and a Southern Center also. If you'd like basic contact information about all those centers, you can go to agrability.info/FARSAN. For those that are not familiar with AgrAbility, we are sponsored also by the U.S. Department of Agriculture and the National Institute of Food and Agriculture. And our mission is to help essentially anyone in agriculture that has virtually any type of disability or functional limitation. There are currently 21 state projects around the country in AgrAbility. Each of those is a partnership between a land-grant university and at least one nonprofit disability services organization. And again, there's one national AgrAbility project, again, at Purdue University through the Breaking New Ground Resource Center. And our partners on that grant include Goodwill of the Finger Lakes, Osteoarthritis Action Alliance, AgriSafe Network, Colorado State University, and Washington State University. You can find out much more about AgrAbility at agrability.org. And we do have more than 160 archived webinars, several of those dealing with farm stress issues, if you'd like to check those out. I'm going to go ahead and introduce all of our presenters at this point. Casey Hulshoff is the Mental Health Voucher Program Coordinator for the University of Illinois Extension's Agricultural Mental Health Voucher Program. Hulshoff was raised on her family farm and now lives on the farmstead where she advocates for farmers and ranchers. The new program gives farmers and their families access to professional mental health care at no charge. Through the Mental Health Voucher Program, Hulshoff collaborates with established mental health providers and connects agricultural producers to professionals in their area. Jendal Wolf is a clinician affiliated with the University of Missouri's Psychological Services Clinic and the Show Me Strong Farm Families Telehealth Counseling Program. She is also contracted to work in a rural private practice that provides treatment for substance use disorders through the 39th Circuit Treatment Courts. Additionally, Jendal teaches an online course at Evangel University. She and her husband live on small acreage in southwest Missouri, where they enjoy raising a few cattle. And finally, Sean Brotherson is professor and extension family science specialist at North Dakota State University. In those roles, he teaches and conducts research on topics in family life relevant to the state of North Dakota and to national and international issues. Some of his areas of specialty include parenting and fatherhood, healthy marriages, family stress, rural families, grief and bereavement, family life education, and family policy. At this point, I'm going to turn things over to Casey for her part of the presentation, and I'll return later for the Q&A.
Thank you so much, Paul. Let me just share my screen here. Hopefully everything looks good on your end. I just want to thank everyone for joining us. And my name is Casey Hulshoff. I'm the Mental Health Voucher Program Coordinator here at the University of Illinois with Illinois Extension. And I'm excited to share with you the Illinois Voucher Program.
We're not seeing your slides yet.
Oh, I apologize. Let me see. Hold on. There we go. Start that over.
There we go.
Perfect. Sorry about that. I apologize. Like I said, Casey Hulsoff with the Illinois Mental Health Voucher Program. And just kind of giving a background, I know a lot of us work with farmers and ranchers, either with the extension or maybe we have ourselves are in the agriculture industry, and kind of know a little bit about it. But just to show, research has shown that agricultural producers and their families are more at risk for adverse mental health outcomes, such as anxiety, depression, suicide, and substance abuse. Farmers and ranchers have unique stressors that are outside of the farmer's control that might look like trade and tariff policies, fluctuating market prices, especially in this economy, loan rates, natural disasters such as flood or other weather events. And all these really make a impact on their day-to-day decisions and their lifestyle. In addition, rural healthcare poses many barriers for agricultural populations, making it more difficult to receive mental health care and treatments. And we often hear about affordability, availability, accessibility, and acceptability when talking about barriers. So specifically, it's how farmers are often underinsured. They don't have access to a provider in their community, or if they do, they're unsure of where to go for help, and also overcoming that stigma surrounding seeking help. And so that's where our voucher program comes into play. So the Illinois Mental Health Voucher Program tries to address these barriers to mental health care. This program allows agricultural producers and their families to seek help free of charge from a certified mental health professional. To combat the barriers that many agricultural populations face in receiving mental health care and treatment, the Illinois Extension has partnered with the Illinois Department of Agriculture and the USDA to fund a mental health voucher program. And essentially the goal of the mental health voucher, the mental health of agricultural producers is to reduce the barriers to professional mental health care. Our program is kind of in three different pillars. We distribute the vouchers for free professional behavioral health. We connect producers to providers in their community, and we also train those providers in agricultural literacy. So a brief overview of how our voucher distribution works is first, the farmer requests a set of vouchers through an online form on our website, and every approved request receives 3 vouchers to be used. And second, once we process the request, we send them the vouchers along with a directory of participating providers across the state. We put the power in the hands of the producer and let them choose a mental health provider that best fits their needs. And third, those vouchers are redeemed with their chosen provider. And then once they've had their sessions, the provider submits the vouchers back to us and we directly reimburse them. And the whole stage, there's no need for insurance to be involved or notified throughout this entire process. And so our program also allows for multiple requests if continued care is requested, because we understand 3 vouchers will not start to finish be enough for everyone, but it's just making that connection for the producers to a provider in their area. Oops, excuse me. So a little bit of a breakdown of our program by the numbers. We started this program in June of 2023. So in a little over a year, we've seen some really great interest and improvements in this program. There's been 204 individuals who have made a voucher request. So that's a total of 612 vouchers being distributed. Of those 200 requests, 35 of those individuals have made a follow-up request like I just talked about. And so that kind of shows us that this program is leaving an impact on producers and helping them in the process of seeking help. Of the 612 vouchers that have been distributed, 306 of those vouchers have already directly been reimbursed to the provider. And although we keep the overall inquiry form very basic, we have gathered that 53% of individuals identified as being part of a farm family, and the remaining 90 individuals said they worked directly in agriculture. So that kind of shows the breakdown between working directly in the industry or being part of a family that's involved in the agriculture industry. And so far, we've allocated $74,850 in reimbursements to providers. The Illinois Agricultural Mental Health Voucher Program also establishes a network of mental health providers who will accept vouchers and distribute vouchers as requested to those agricultural producers and their families who can seek care from the network of approved providers. This is that second pillar of our program. And a unique aspect of the Illinois Voucher Program is that we work directly with mental health professionals who are already embedded in their community. They know the needs of their members, and they are well-versed in what's going on in their communities and the resources they're able to provide. And so before the program rolled out, we created a directory list of participating providers. We currently have 106 partnering providers across 38 counties in Illinois. And most of them, which 86% of them, offer telehealth services. So even if someone is not directly in your community, hopefully you can connect with someone and seek services via telehealth. And recently we have added 2 Spanish-speaking providers to support our diverse agricultural population in Illinois. And the third pillar of our program is the Agricultural Literacy Training Program. It is developed to ensure mental health providers are prepared to work with agricultural clientele. It would be really disheartening as a producer to hear, oh, you're just stressed out, take a vacation, take a week vacation off to the beach when you're a dairy farmer and you can't just pick up and leave. And so we encourage all of our providers to enroll and complete the course. It describes the unique characteristics of the agriculture and agriculture workers. It identifies common mental health and substance use challenges for producers, and it explores strategies for working with farmers and agricultural workers. In addition to our program, after about a year in existence, we wanted to reflect back and see, what can we do to make this program better? How's it working for everyone? One of the interesting comments one of the providers responded was, we need to bring it to many, many more rural farmers. And I think that's so telling that this program is effective and it is working in the communities that we're in. And so another question we actually asked was, we'd love to hear the good things, but also tell us, where are the challenges or pain points in delivering services? And survey participants noted the ongoing stigma surrounding mental health is a challenge when it comes to providing services, because one first has to admit that they need and or want help. And another challenge was delivering services since some individuals did not know about the program. So from this, we took, how do we reduce the stigma and how do we market this program better? Recently, we have done marketing campaigns with Farm Bureau and Farm Week Now and saw positive results from that, but we're constantly trying to improve and bring this to more farmers and farm families. Another interesting point was the providers that we reached out to. We had 9 who have gone completely through the program respond. So that's people who have signed up, have taken vouchers, and have requested reimbursement. So 9 of these providers were asked the following questions, and 100% of them agreed that there is a need for low or no cost behavioral health services amongst farmers, that 100% agreed that their clinic is supportive of their participation, 100% agreed the program is reaching the correct clientele, 100% said the program is meeting a critical need, and that they would recommend this program to their fellow providers. So to me, that shows the importance of this program and the outreach that it is providing. Again, it's just our step in, marketing this program to more farmers, to more farm families, and really getting the word out there and what we do. We did ask the providers as well, remain vague, but kind of what are the themes that you're hearing amongst these clients? And they said things like general depression, anger, and anxiety, limit to access to resources such as counseling, the marital status, the stress on an entire family, the worries of price of grain/meat production, the anxiety over instability of income, and producers not wanting to disappoint their family with their concerns. And for those of us in the industry, this is not uncommon, and sadly, probably a theme that we've seen from previous years as well. I want to take this time to say thank you. Through USDA and the Illinois Department of Ag, that's where this grant is from, that we're able to do this work. Again, thank you to all of our partnering providers and the work that they do day in and day out. And also thank you to my colleagues, Cheyenne, Courtney, and Josie. I did leave a QR code here that you can scan for more information or even take you directly to request a voucher and kind of see our website and what we offer in addition to the voucher program. And I would love to take any questions at the end of the webinar.
Thanks so much, Casey. Again, please feel free to enter questions in the chat area or make note of them so you can ask them verbally at the end during the Q&A period. And now, Jendal, we'll turn things over to you for your section of the presentation.
Okay. Share. Okay, so this is from Missouri. The first thing that I wanted to really emphasize in this is the best way to describe our program, because it isn't necessarily a voucher program. It's just more of a collaboration between several entities. Those entities include our funding sources, the outreach and promotion entity comes from MU Extension. The administrative support comes from the Psychological Services Clinic. And then the last is the mental health services comes from me, the clinician, in the form of telehealth services. So it's just a strong collaboration between all of these entities. So the education part of this, the boots on the ground, comes from MU Extension. So they are individuals talking with farmers and ranchers and rural individuals that they see at workshops, individual consultations, and other events. They diligently promote mental health and where to find it. So that's really important. I know that we've already heard that. That's just educating what mental health is, letting people understand that it's okay to ask for help. And one of the things that I think that they do a great job of is they will encourage people to call the phone number that we have, or there is a form that can be filled out to request these services. And sometimes they will even sit with them while they do the phone call or fill out the form. So there's a lot of individualized support there. So that comes from MU Extension. The PSC, which is Psychological Services Clinic, so once the individual makes contact with them, so that's where the phone number, the phone call goes to, and the form. So when the individual makes contact, they will either talk to an intake specialist at the PSC, or the form is routed to someone who reviews the request for services. They will then forward the information to me, the clinician, to make contact with the individual. So what I then do is I have about a 15-minute conversation with each individual to make sure that it's the fit, make sure that it's services that I can offer, and just have that brief conversation with them, and then I start services with them. So a little bit about the PSC is they are on campus in Columbia, Missouri. I am not in Columbia, I'm in Southwest Missouri. They provide assessments and treatment services to youth, adults, and families. They train MU doctoral trainees in clinical psychology and related disciplines. And they support research, advancing the understanding and effective promotion of psychological health. So it's a robust clinic, so they offer a lot. And I work through them. So the PSC offers clinical administrative support and coordination. They also provide equipment by which I do the telehealth, and they are also where the electronic medical records are kept. as the sole clinician for this program. They are the backbone to what I do. I was just looking at the other program with 106, I think, clinicians. That's awesome. For a sole clinician, I need the administrative support. So they provide services that I may not, that I may need to request from them. So if they do assessments or they need an assessment done for a diagnosis, then the clinic can also do that as well. So one of the other things that they provide is screening to every person who calls in to request services to this clinic. So this means that some people qualify for this program, the Show Me Farm Families program, and they don't even know it. And so they're a clearinghouse for anybody that's already reaching out for services. And so this screening process allows them to let the potential clients know that, hey, you may qualify for this program. And so that's when it gets sent to me. And then I review that as well. So a little bit about me. I am a licensed professional counselor. And this is the second time I've worked for MU. The first time I worked at the Southwest Research Extension and Education Center in Southwest Missouri for about 5.5 years. And my duties included administrative, event planning, being a liaison between campus and the center. I worked side by side with the researchers there on many of their projects, and that can include counting blades of grass, taking soil samples, or simply being the go-getter when they were working cattle. One of the other duties I performed was to greet people as they came into the center. I chatted with individuals on a daily basis and met people from all around the world. As I listened, I began to hear stories of loss, and people just didn't know how to support others when there was a lot of loss or there's some things that were going on, let alone how to support themselves. One of the stories that stood out to me that I remember is a farmer had a turkey barn that burned down. And the devastation is layered here because it's not just the loss of business, there was a loss of animals. And so with any farmer that has livestock, they care very deeply about their livestock, not just because they're part of their business, but because of who they are. And so that was one of the stories that really stood out to me. So this got me thinking about mental health and how I could make an impact in this area, because at the time I was more administration. So this prompted me to obtain my master's degree and then partner with MU to provide counseling services. One of the things I want to point out is that there is not a set limit of sessions for our program. It is up to my discretion, but right now I'm averaging about 12 sessions per client. The importance of our program is we decided to go with this type of a program to provide solutions to several barriers, which has already been talked about. So one, we wanted to work on the stigma part of it, because we all know that people do not want the whole rural town to know what their business is. That's part of rural living, right? So we provide confidential sessions that they can attend while on their farm. They don't actually have to go anywhere. They can use their phones or a computer. And this also is the time saver, because sometimes they would have to drive 30 minutes to an hour one way just to go somewhere where there was a provider. So telehealth is the solution to that. The third barrier that we currently overcome is the money. And so we do provide these services for free. The last barrier is the internet. So we did run across this where we had a farmer that did not have internet at his home. And so we had to come up with a solution. And we partnered with a local office that could provide a space that offered confidential space for us to do this. And we called it consultations, because that is a term that's used for any extension professional. And so to be HIPAA compliant, we just called them consultations, and we didn't call it counseling or anything. So the nature of our program is really to have the client, we go to the client rather than have the client go to the clinician. And so we just had to kind of overcome we've had to do some problem solving there. So in conclusion, we have formed strong collaborations between several entities in order to provide a robust program for farmers, ranchers, and rural individuals. We are currently expanding to rural doctors' offices and reaching out to rural agriculture businesses. This would be a benefit to small agriculture businesses that can't really offer a lot of benefits, but this would be a benefit that they could offer to their employees because they work in agriculture. Without the direct support from the PSC, it would be much harder to make this program work. And we wanted to see if we could break down as many barriers to accessing mental health as possible. So I wanted to end with just a very brief story. We had one farmer who had severe medical issues, and this service was offered to them, and they were super thankful because their physical issues kept them homebound for several months. And this was an outlet for that individual to talk about what had happened, to process through it, and have a lifeline. And they were super excited about having this. So I am the clinician. I did not have any numbers to go with this. So if there's questions about that, I can get that for you at another time. But that's all I had. So thank you.
Thank you, Jendal. Appreciate the information. And now we'll turn it over to Sean for his section of the presentation.
Thank you, Paul. Let me go ahead and see if I can share my slide set. Are you able to see that?
Yep, looks good.
All right. Good to be with all of you today. My name is Sean Brotherson, and I work as a professor and as Extension Family Science Specialist at North Dakota State University. And I'm the lead contact for the Farm and Ranch Stress Assistance Network project in North Dakota, and have been for the past several years. I was born in the Midwest, but grew up primarily in the Western United States, and was raised as part of a big ranching operation, raising beef cattle. And when I think about agriculture and the topic of counseling, I was raised by a 6'2" rancher with a cowboy hat and a big handlebar mustache. And I remember when I was a teenager, talking to my dad about some things he was doing, and I asked him what he was involved in, and he said that he was going to a counseling session for depression. And so, because I had that example in my family, the idea that someone involved in agriculture would not be able to access counseling services was a little bit foreign to me, because I saw it happening in my own family, and it kind of gave me permission to understand that taking care of your mental health is an important part of the entire profile of taking care of yourself when you're working in agriculture. So with that background, let me talk a little bit about the context and about our project here in North Dakota. So as research indicates, farming tends to rank among the top 10 most stressful occupations in the United States. And Paul, I'll ask if you can see that my slide advanced, yes or no?
Yes, looks good.
All right, thank you. And research from the National Occupational Health and Safety Administration indicates that individuals who are working in agriculture tend to have a higher rate of stress-related physical illnesses. So that can be everything from heart disease to high blood pressure to other things, and then also tend to have a higher rate of mental and behavioral health concerns, including things like anxiety, depression, and substance misuse. Well, as you look at some of the pressures occurring in agriculture, and those have been referred to by Casey and Jindal, often there will be specific pressures originating within agriculture because of the external factors that are often beyond their immediate control. Those may be weather issues, they may be price fluctuations, they may be policy circumstances that are affecting them. But what we tend to see, and what this model shows, is that rural stresses tend to ripple through the family. And so immediately they begin to see financial pressures. That spills over into personal stresses and individual anxiety or other things. And then we often see it spill over into stresses within their family relationships and their business relationships in the agricultural operation. And so being able to address that effectively means understanding the context that someone in agriculture is working in and how those stresses can ripple through their life and cause concerns for their health and well-being. I like this little graphic. It's from some research that was done, focus group research done in Australia on mental health in agriculture. And there's a comment from this one participant that I like, and he commented of himself and his fellow farmers and ranchers. They maintain their tractors, they maintain their pumps and everything, but they don't maintain themselves. And so in our project, we've adopted a little bit of a mindset and key messages that we want to share as we market the availability of mental and behavioral health counseling for those working in agriculture. And the first is that your health is actually the most important asset that you have as a farmer, rancher, or agricultural worker. There's a lot of other assets that you deal with, land, buildings, capital, labor, things like that. But your health is actually your most important asset. And if it is your most important asset, then the health and safety of those working in and around an agricultural operation need to be the most important priority. And so we try to lead with that message in the marketing that we do. As was noted by Paul, the Farm and Ranch Stress Assistance Center in the North Central region covers 12 states. Illinois is the lead state on our grant, and as noted, North Dakota is one of the participating institutions. And in the funding from USDA NIFA that provides grant support, it notes that grants can be used to initiate, expand, or sustain programs that provide professional agricultural behavioral health counseling and referral as necessary. And so we were interested in doing that. We're one of a few states in our region that decided to pursue that. And so in our particular project, we sought out partners that we could work with to establish a counseling program. And so our educational lead and partner on the project is NDSU Extension, based at North Dakota State University. And then our primary partner for counseling efforts is Together Counseling, which is an established mental health provider in the state of North Dakota and the upper Midwest. And so partnering with an established mental health provider was important to us because they have reach and expertise that we did not have. And so we established that and were able to begin operations in the spring of 2021. Basically, and I would, similar to what was mentioned by Jindal, I would not necessarily call our program a voucher program, but it is a program in which we have funding to extend. We work with the health provider if there is one that exists for the client, and are able to either cover the cost of services or partial cost of services based on working with their providers, or if they don't have a provider, then we can cover the cost of the counseling. But so since we began the project, the basic elements of our program are that counseling is available at no or limited cost. The counseling sessions are available for those who work in agriculture or related fields. It's available in person or by telehealth. And we found about 65 to 70% of our counseling sessions are telehealth. And it was important that our providers be ag-informed professionals. So these are counselors who either currently also work with their families in the field of agriculture, or who have a history of connection to the field of agriculture. And so they understand the context and needs of those clients. Our lead contact for this project with Together Counseling is Becky Kopp Dunham, who runs a family farm with her family in Minnesota. And Becky's on the call today as well. So in marketing our program, we developed actually just a small marketing tool, a wallet-sized card that could be shared widely, that listed the available resources and that counseling was available. And then we just printed those en masse, shared them with our extension offices, with other partners such as Farmers Union across the state, and then encourage them to share the information widely in any meetings or contacts that they have had. And so finding someone who can be a champion for your program, I think, is really, really valuable, which is one thing that we were able to benefit from. This is Cindy Clapprich, one of our extension agents. And I know that Cindy handed out hundreds of copies of this in her community, trying to let people know about the availability of the program. And so marketing is important. If you have a resource that's available but cannot reach your potential participants, then that's a challenge. And so we've tried to do quite a bit of outreach to let people know about our services. This is a booth that we have at a big farm show here in Fargo every fall. It's happening actually next week again. And this is myself and our partner provider, Becky from Together Counseling. And Becky and other staff members working with it have been really good about partnering with us to do outreach to let people know about our available programming. If you look at our counseling sessions that we've had, it took a little while for us to get going. We had about 8 to 10 counseling sessions for the first 4 months we were in operation. Then that ramped up, and in the summer of 21, and about the summer of 21, we started to average between 30 and 50 counseling sessions. And that was pretty common for most of the next year. We found that in the springtime, our counseling sessions, we reached our highest numbers, which was 90 plus counseling sessions a month. And then as planting season came on, we dropped back down in the spring to about 30 sessions a month. So there's variability depending upon the agricultural season as to how much individuals might be available to participate. But typically we've averaged, I think, between 40 and 60 counseling sessions a month since that time. And you can see that over our first 2 years. Some key things, we've had 4 key providers or counselors. The number of sessions per client has ranged a little bit from a low of about 9 sessions to a high of 16 sessions. I'll note that a couple of these counselors, they may have had individual clients who were what you might call a high volume client, who might have a pretty high volume of counseling sessions, as high as 30 or 40 counseling sessions. And so that's not the typical number. If we took out those outliers, we'd have maybe a smaller number of sessions for some of those providers, but that's typically what we have seen. And we've been willing to cover the cost of however many sessions were needed per client. The cost per client has ranged anywhere from a low of about $600 per client to a high of about $1,300 per client, depending on the counselor and how many sessions that were being held. We planned in our grant to hold about 125 sessions a year. We found that we could hold more sessions at a lower cost than we anticipated. And so in our first 2 years, we did about 125 sessions the first 6 months of the first year, then about 300 sessions after that. So we have been averaging about 600 to 650 sessions a year, reaching this says 85 clients, but that's a little while ago. So well over 100 clients during the time that our program has been in operation. Just wanted to wrap that up. A lot of gratitude to Together Counseling. They've been a very effective partner. Their experience has been invaluable in working with our clients, and to USDA for providing this funding.
Thank you, Sean, and thank you to all of our presenters today. Interesting programs. We do want to note that there are other voucher programs around the country in the different FARSEN centers. In fact, I've put the links to those centers if you're interested in finding out more about the centers or programs that they're invested in. You can feel free to check out those websites and get information on their resources. I know we've had some questions and answers put in chat already. At this point, I'm going to invite more questions, and feel free to raise your hand using the icon at the bottom of your screen if you'd like to ask a question verbally. I'm going to turn things over to Ed to summarize the Q&A so far, and also I will return at the end. Thank you.
All right, so it looks like the first question here, is there a limit on how many requests someone can make? No, we currently do not have any limits. We keep that open. We don't feel like we're the ones who should dictate how much or how little help someone should receive. So as long as the grant money is still there, we tell our providers to and encourage them to tell their clients to make requests.
Okay. Now I think I'm back online now, so and have the right. There we go. Okay, this is more of a comment. Thank you, but also, and you already replied, Casey, but we'll throw it out there in case somebody hasn't seen it in the chat about. It's mentioned that voucher programs are marketed through farm organizations, but are any voucher programs being advertised at clinics, healthcare facilities, or local health districts or courthouses? If you want to go ahead and expand on that a little bit, that'd be great.
Yeah, I can. I thought it was a great question from Sarah, and helping advertise and market. Like I said, we give the providers under their confirmation email, saying here is resources for either your social media platforms. In your office, we gave them like little flyers, just kind of a breakdown over the program and how to make requests. I've had, been contacted by agencies or saying, hey, can I run this in our paper? Yes, of course, anything they need to market the program, I try and assist with as well. And a lot of time agencies have their own way to market and make referrals as well. But I did like her ideas as far as marketing or advertising in healthcare facilities or local districts and or courthouses. So that might be something we take back to the team and see how we can expand on. So thank you, Sarah, for that.
Great.
Can I add just something on that real quick? Also, partnering with your probation and parole offices, they have a lot of farm workers through there as well, and that is something that I just started last week to do.
Thank you.
Okay. And I tried to keep track of whose questions were whose, but I know there's going to be some overlap, so feel free to jump in. But this one came in for Jindal. What's the primary way that Missouri farmers hear about the program? Yeah, right now Extension is running a lot of social media posts right now, Facebook, Instagram. There's a bunch of that going on right now. The Extension offices, any of the Extension offices should have that information. I can also post the link in the chat as well. It was in one of my slides, but I can pull that in. So right now that's primarily that and word of mouth. Okay. Any other thoughts from John? Okay.
Yeah, I put a note in the chat. We primarily worked with agricultural media partners in getting messages out about our program. We've also worked with our State Department of Agriculture to put together a brochure that they have shared widely. And then just other healthcare and educational partners. Being part of the network of Extension has been just invaluable because our Extension staff have shared the information widely with their partners and in their local communities. And so we've really had just a big variety. We have found that sometimes it's not necessarily the agricultural producer who comes first to the table looking for counseling support, but a member of their family who will say there's a need in our family, and they'll start, and then they will kind of bring in and refer the main agricultural producer. And so sometimes you're reaching someone in their circle who then they will kind of bring them to the experience. And so that's been important to have your criteria for someone being able to take advantage of these services be broad enough that it catches the circle of people who might be around someone in agriculture.
Okay. All right. Well, okay. Now this question had several answers and responses. So we'll start out with the question as a broad question. Are there any ongoing evaluations or publications associated with this program, sort of a best practices guide for practitioners or researchers in other states who wish to implement the program? Jendal was talking at the time when the question came in, but we've got a variety of responses. If you haven't been following the chat, Karen, go ahead.
Sorry, I do a pre and post evaluation for every client. So that information is being collected. We have not done anything with that yet. That is part of the PSC, the clinic that I work through. So we are doing a lot of evaluations that measure the levels of stress, anxiety, the issues that they were bringing to us. What, was it successful? Were we successful with helping this person? And so we're using those evaluations for that. And then the best practices guide for me is my profession. So when you have a professional counselor, they go by their best practices and their ethics board and all of that. So I don't know if that answers everything in that.
Okay. Looking a little further, Karen mentioned that Wisconsin has a guide for their counseling voucher program, and then skip a line there, and is happy to send it to anyone that requests via email. And there is her email address, Karen K. Endress at wisconsin.gov. And then in the middle there, Cheyenne, Illinois is also working on evaluating our program. Casey touched on the feedback we got on the evaluation, but as of right now, there's nothing published. But we are there is ongoing evaluation. Cheyenne, feel free to jump in if you have any thoughts about that or want to expand on that. And then, and honestly, I didn't write down. Oh, Casey sent this in. Any further comment about your literacy training?
Yeah, the link to the literacy training is there, but kind of circling back, if anyone on the call ever needs, I've talked with other states before, is if they're starting this voucher program, please reach out to me. We can set up a time to call. And because I received a lot of help when we were setting up ours. I think I talked to Sean actually, and just kind of what we've done, what we, maybe what we would have done differently or what was super helpful. So if you are starting up a voucher program or something similar, feel free to reach out, send me an email. I think my email's in here somewhere. I'll put it in the chat as well. But I would love to help out because I received a lot of help in the beginning as well. And so anything I can do to assist, I would love to help out with.
Okay.
Yeah, I would
go
also,
ahead.
Yeah, I would note that that the voucher model of program is probably the most common model that's being used in states that are trying this across the country. And we've had a small work group of people from across the country kind of collaborating just to pursue some of those very questions that were asked in that question. I will note that We also have an evaluation that we've put together. We haven't put it in the field yet. We're looking to do that this fall. So we have that research project, and we have another research project that we're getting ready to implement that will be talking to counselors who are working with agricultural producers in this context to learn about best practices. So that question got right at 2 research projects that we've developed and are getting ready to implement. So I guess I'd say stay tuned and follow up. If you have questions, you can reach out to me. So.
Okay. And I think this next question basically follows up with that, with the answer. I think the answer, the previous slide came in first, but then the question came in. So unless anybody wants to add, as far as getting your counselor specific training for farm culture, or anybody has anything to add on that, feel free, or we'll see what the last couple I have. Okay, there are regional far sand centers that Paul posted. And let's see that. Okay, that is the last slide. Now I got to go back and see how many. We always have questions come in while I'm doing the slides. So, okay. Michaela mentions that more information on North Carolina's Farm Stress Initiative can be found at ncfarmstress.org. So thank you for pointing that out. Let's see. Colorado has a 6 voucher program. This is Kirsten. Any questions or thoughts on that? Feel free to jump in, Kirsten, or want to have a reply to Noah's question from earlier. We have a couple research projects. This is from Sean. Have a couple of research projects underway evaluating the effects of our counseling efforts. And I believe that was already kind of covered that. Karen has a link to the DATCP Farmer Wellness Program with Wisconsin.gov. Another comment from Sean. Thanks for. I'm not used to everybody answering on their on the chat. So this is great. We've worked with Ag Media, State Department of Ag, and other healthcare providers. Casey has a link to their farm stress program. Jindal, what did I do? I skipped it there.
And I would say in response to that question about farm culture, Casey's program is specifically about that you're providing kind of agricultural literacy training for the counselor provider. I would know one of the reasons, and we've found in our experience that familiarity with the agricultural context is very important as a trait that folks in agriculture are looking for when they're seeking out counseling support. If they don't sense that within a couple of sessions, they're more likely to maybe terminate their experience than continue it. And so that was an important characteristic for our counselor providers. Even though you can work with those clients and not have a farming background, it just gives you a big advantage if you already have that agricultural familiarity. So if you can find counselors that combine that counseling experience plus having familiarity with the agricultural context, it'll be a benefit to your program in a big way.
You took the words right out of my mouth, Sean. I was kind of waiting for that gap. And also a really amazing thing about our literacy program, it counts for the providers. It counts as continuing education units. So they have to keep up so many year, they call them CEUs. And so that counts towards their hourly requirement as well. So a lot of our providers it's kind of like a win-win. They get to count them towards hours. They get to learn more about these clients that we're sending them as well. And yes, you're right. I've received a lot of calls saying, I've went to a counselor before, they just don't understand, or I'm here spending half the session explaining why this is so important or how this affects me. And no one really wants to do that. So you made a lot of great points there about our training that we offer. And so much to the fact we've had other states, requested as well. Josie and Courtney did an amazing job trying to put as much relevant information together for the providers without seemingly overwhelming them at the same time. So the training, I think, is really a unique aspect of our program, and I think it's beneficial for all parties involved.
Okay. Let's see. Let's see. Jindal provided a link to the Missouri's program. We keep adding more here. A note here from Daryl: check with your local radio stations about running public service announcements, or better yet, contact agribusinesses about underwriting radio spots on a paid basis that they guarantee the airtime. So great suggestion there. Do any of these programs extend into Wisconsin? The self-employment specialist for Easter Seals, Wisconsin, ended up work with a lot of farmers who want to expand their business. Help with mental health might allow them to be more consistent. And Karen responded with information about the Wisconsin Home Farm Center. So thank you. Chad, CSU and Colorado AgrAbility project developed cognitive behavioral therapy approach and interventions that is tailored for ag populations called Land Logic. Feel free to reach out if interested to learn more. And Chad provided his email address there in the chat. And I think, well, they keep adding here. Our CEUs provided Sarah asked, are CEUs for providers standardized nationally, or does each state have different requirements for the courses or required courses? Sean, you replied. You can, if you want to expand on your reply.
Yeah, I would just note that the CEU requirements kind of tend to depend on the mental health professionals training and also the professional organization that they works with that certifies them as a provider. So there can be some variation, you know, if you're a social worker versus if you're a licensed professional counselor, or so there's different designations you can have, and your CEU requirements are going to differ a little bit based on the association that you work with and if they're at the state or national level. So I would say it's variable.
I know specifically they worked with the at the university, the social workers. It is for social workers, I believe the licensed counselors. It qualified for more, but it is definitely state, like our program is only for the state of Illinois. And even within that, they're very, like Sean said, specific professionals that it applies for. But I think if someone were to start a program and work with their university colleagues in similar areas, I would be interested in providing those CEUs and see what you could set up. I know Courtney did a lot of work for us working with I believe it's the College of Social Workers. However, I think it was a good perk as far as providing information for those mental health professionals in our state.
Okay. And Jindal adds a comment. One area to add for training is trauma informed in therapies. Would you mind explaining what your thought there is?
Yes, almost everybody I've worked with, we've had to work through some trauma. So just adding that piece to some of those trainings for your clinicians would be a huge help. Not everybody can work in trauma. It is one of my specialties, so that is probably one of the reasons why I was chosen to do this program. But a lot of our farmers and ranchers, they see a lot. They see a lot of things that can cause some trauma. And so just being able to spot that and know how to handle that and work through that would be invaluable training for them as well.
Well, thank you all. At this point, I don't see any more messages in the chat. If anybody has more questions, raise your hand or type them in. And then with that, I'll pass it back to Paul.
Well, thank you, everybody. We're just over the hour by 2 minutes. We appreciate, again, all the expertise and input from our presenters and also the interaction from our participants today in chat. Again, we are archiving this, should have it up within the next day or two. Feel free to check that out and you will get an email about the link. We do conduct these North Central FARSAN webinars twice a year. So you're on our list now and you'll be receiving information about the upcoming one. We have not yet planned that one. So again, thank you everybody, and we wish you a good rest of your day.